There are a few common practice models in physical therapy. Let's talk through the pros and cons of each. The first common practice model is being one-on-one with your patients for 40 minutes and treating patients every 40 minutes throughout the day. There are some pros to that. Number one, you get to spend one-on-one time with your patient for the entire time, ideally. Although, there are times when you have to double book, either at the beginning of the day, at the end of the day, or we need to fit somebody in. The cons of that are, with only 40 minutes of dedicated time, sometimes you can focus primarily on the patient-identified problem and miss out on some of the other factors that we know are going to predict anticipated problems, you just don't have time to get to. A second common model is double booking on the hour, usually without anyone helping you out in the gym. The pros there are you get one-on-one time with your patient for 30 minutes, as long as you don't have to double book beyond that. And the cons are, with only 30 minutes of one-on-one time and another person in the gym that you have to keep an eye on, sometimes it can be hard to really get that true one-on-one experience for your patients. Just like the previous discussion, an hour, although it's a bit more than the 40 minutes, you still may not have enough time to really get to all those anticipated problems, including core, cardio, and other things that we know our patients need. A third common model in PT is 4 patients per hour, or patients every 15 minutes. The pro to that model is you do have dedicated time for each one, but it's only 15 minutes, so that can be a bit of a challenge. It's also nice that more patients get in and get seen, so we're able to cover the community a little bit easier. The con can be, even though you may have help in the gym, they may be high school kids or college kids trying to get hours for PT school. They may not be the best trained people, and they may be at a ratio that makes it difficult for the patient to get the type of care you're really looking for. So what do those 3 typical models have in common? Number one, they maximize revenue. In physical therapy, most revenue happens within the first 45 minutes. Insurance companies tend to cut off payment after that. Number two, they tend to minimize cost. In the first 2 models, there aren't gym help team members. So the 40-minute one-on-one, the double book on the hour, you usually don't have help in the gym. In the third model, you've got a lot more revenue and a low-cost provider helping out in the gym. So if you maximize revenue and you minimize cost, you tend to maximize profit. Unfortunately, as you saw in those first 3 examples, sometimes at the expense of patient care. I would like to offer that it is possible to have the patient care that you want and remain healthy as a business. I think we can deliver thorough care to our patients. I think we can have sufficient one-on-one time and have qualified people in the gym to help us out. There are models out there that put patient care first and have profit as a necessary element, but a secondary piece of the puzzle. As you look at your own practice model or assess organizations that you're interested in, hopefully this framework is helpful in helping you make a great choice.